Good evening, people. This is Stupid Insta question 7. The drug of choice for atypical pneumonia caused by Mycoplasma pneumoniae is A. Amoxicillin, B. Azithromycin, C. Ceftriaxone, and D. Gentamicin. Okay, let's understand what classification do these drugs come under. Amoxicillin is a classical example of a cell wall synthesis inhibitor. Ceftriaxone is an example for the same class called as cell wall synthesis inhibitor, but amoxicillin comes under beta-lactams called as penicillin group of drugs, while ceftriaxone comes under beta-lactams which are cephalosporins. What is common to both of them? Both these drugs will inhibit the formation of a cell wall. Gentamicin is an aminoglycoside who is important for protein synthesis inhibition. At the same time, azithromycin is also a wonderful example of protein synthesis inhibitor. The point here is amoxicillin is a classical example of a bactericidal agent that is also followed by ceftriaxone. Gentamicin is also a bactericidal agent, while azithromycin is a bacteriostatic agent. Remember, the drug of choice in case of Mycoplasma pneumoniae will most commonly be a macrolide. Sometimes it can even be tetracycline group of drugs. Here, the amoxicillin and ceftriaxone who are trying to block the cell wall synthesis in a particular organism will prove to be failure in case of Mycoplasma infections. Why? Because Mycoplasma is a unique organism. It is the tiniest among all the free-living bacteria and does not have a proper cell wall. When it has no cell wall, then what is the point of blocking the formation of a cell wall in such an organism? It is of no use, right? So both amoxicillin and ceftriaxone will be a failure. But gentamicin is an organism which is very heavy in terms of molecular weight. And uptake of gentamicin by Mycoplasma pneumoniae is very poor. Because of it, gentamicin will not play a very good role in case of Mycoplasma pneumoniae. At the same time, gentamicin can be very effective against intracellular organisms, while Mycoplasma pneumoniae may be found intracellularly, but most commonly can be found in the extracellular atmosphere. That is why it can be grown on artificial culture media. Azithromycin is the best drug of choice. It comes under macrolide and it can be a very good treatment in case of atypical pneumonia caused by Mycoplasma pneumoniae. This is the theoretical explanation for the given question. Thank you.